welcome to this explainer. Today, we're going to decode the exact messages your knee and leg pain are sending you. We're drawing straight from the medical literature and clinical guidelines to really figure out the mechanics of your body. So if you've ever felt a mysterious twinge, a dull ache, or a sudden sharp pain in your knee, you are absolutely in the right place.
Here's our roadmap for today. First, mapping your knee pain. Second, muscle strains versus ligament tears. Third, understanding runner's knee. Fourth, evidence-based recovery protocols. And finally, exactly when you need to seek medical care. Let's dive in.
Section 1. Mapping your knee pain. We're kicking off our diagnostic journey with your most immediate symptom. Take a quick second to self-reflect. Where exactly does your knee hurt right now? Because the knee is one of the most complex joints in your whole body. It flexes, it extends, it twists. The specific geography of your pain is literally your biggest clue to what's going wrong beneath the surface. It's like a giant puzzle.
According to Healthline, if the pain is strictly above the knee, you might be looking at tendinitis in your quads or hamstrings. Basically, the tendons attaching your muscles to your bones are getting inflamed. Alternatively, pain up there could also signal an inflammation of those little fluid sacs called bursae, or even knee arthritis radiating up from the joint itself.
Now, what if the pain is dead center, right at the kneecap? Well, this anterior pain often points to patellofemoral syndrome. It could also mean cartilage deterioration, known as chondromalacia, or maybe tracking and alignment disorders, where the kneecap just isn't sitting right in its groove. It could even be inflammation of a layer of fatty tissue tucked right under the kneecap, called Hoffa's vat pad.
Now this is where it gets really fascinating, how side pain differs. Inner or medial pain, that often means MCL or meniscus issues, which are frequently caused by a bad twist or some sort of trauma. On the flip side, outer or lateral knee pain typically points to iliotibial band syndrome, usually from repetitive bending or an LCL strain.
Finally, if you've got pain just below the knee, that usually indicates patellar tendinitis, colloquially known as jumper's knee. But if the aching is directly behind the knee, in that posterior region, well, it could be a fluid-filled Baker cyst where excess fluid builds up between the joints, or it could simply be tendinitis of your calf muscle.
Section 2. Muscle strains versus ligament tears.
Let's transition from where it hurts to what is actually hurt. We're drawing on clinical insights from Doctronic here to differentiate between two commonly confused but totally different injuries. A muscle strain means the actual movement-generating fibers are damaged. Think of it like pulling a rubber band just a bit too far. It usually happens when you ask a muscle to work way beyond its capacity, like during a sudden sprint or lifting heavy while you're fatigued. The pain is usually super localized, right over the muscle belly.
Conversely, a ligament tear involves the connective ropes holding your joint together. Your ligaments act as passive restraints to maintain proper alignment. When they tear, often from an awkward landing or a sudden sharp pivot, it severely impacts your joint stability. Honestly, it makes the whole knee feel loose or totally unreliable.
And this perfectly illustrates the contrast. Muscle strains cause this localized cramping or pulling pain that typically heals up in about 1 to 3 weeks with proper stretching. Ligament tears, though, they cause a deep, unstable joint pain taking anywhere from 6 to 12 weeks to recover. Plus, because they have a much lower blood supply, they actually require prolonged immobilization or bracing to heal right.
Section 3. Understanding runner's knee. Let's explore a specific case study to see how all this comes together. Patellofemoral pain syndrome, often called runner's knee, PFPS is a classic overuse injury. According to the medical literature, it's frequently caused by abnormal tracking of the patella. A super common culprit here is a muscle imbalance. For example, a weak vastus medialis in your quad can end up pulling the kneecap completely out of its proper alignment every single time you move.
This condition actually has a couple of really fascinating clinical hallmarks. Does your knee ever hurt after sitting through a really long film? That's literally called the movie sign or theater sign, and it comes from the prolonged pressure of sitting with your knees bent. Or maybe you can't point to exactly one spot that hurts, but instead you have this dull ache in a vague circle around the kneecap. Yep, you guessed it, that's known in the medical world as the circle sign.
Section 4. Evidence-based recovery protocols. So, the big question, how do we actually treat these tissues? Instead of just resting and crossing our fingers, let's look at scientifically backed physical therapy. To actively rehabilitate things like patella tendinitis, Bourne Sports Medicine prescribes this highly specific eccentric exercise protocol. You use a 25-degree decline board, and you do 3 sets of 15 slow, controlled lowerings, counting to 3 on the way down. You do this twice a day, every day for 12 consecutive weeks.
Now, this is incredibly counterintuitive, but absolutely vital to know. Do not panic if these exercises hurt a little bit. Mild controlled pain actually stimulates tendon remodeling. We're trying to rebuild the tissue here. In fact, if the reps start feeling too easy, clinical guidelines suggest you should actively add weight, like throwing on a loaded backpack, to make sure the tendon keeps adapting.
Furthermore, for broader joint health and managing things like osteoarthritis, studies from the BMJ and PubMed emphasize that low-impact aerobic exercises, specifically walking, cycling, and swimming, combined with weight loss are absolutely the optimal strategies. They reduce the compressive load on the knee joint while maintaining the exact mobility you need to keep your cartilage healthy.
Section 5. When to seek medical care.
While conservative therapy, targeted exercises, and resting work for the vast majority of knee issues, we absolutely have to know when to abandon the at-home treatments. Sometimes your knee is telling you something much, much more serious. Pushing through the pain or just popping an anti-inflammatory is literally the worst thing you can do if you're dealing with a severe structural failure. Misidentifying a major injury can lead to improper healing or permanent joint instability, and nobody wants that.
Take a close look at this list. If you hear a distinct pop during an impact, absolutely cannot bear weight on the leg, or see sudden, dramatic swelling or a physical deformity, these are absolute red flags. No question. Additionally, if standard rest doesn't improve your symptoms within 48 to 72 hours, it is time to get a professional medical evaluation, and possibly even an MRI.
As we wrap up this explainer, I want you to leave with this exact thought. Pain isn't just an annoying nuisance. It's complex, structural data sent straight from your own body. So ask yourself, are you just masking the problem with a knee sleeve and hoping it magically goes away? Or are you truly listening to what your pain is telling you to do next?